Hello students, good morning. Today we will learn how to select a research topic and formulate a research question. You will be doing a cross-sectional research during this year. So this slide will help you how to select a research topic and how to identify a research question. Formulation of a research question is the first step in a research. Okay. A research question is a question that identifies the phenomenon to be studied. What is the main research question that you are addressing? You have to find out. The research question should be clear, focused, concise, same time a bit complex also, and arguable question around which any research is centered. Okay. Research question must be formulated by analyzing the available literature. Literature means all the published research or published evidence on the current research topic. You have to search for all the available evidence, and a research question must be formulated based on the available literature. What is the potential impact of the research which is proposed? What is the benefit of answering the research question? And who will be benefited? And how they will be benefited by this research? Okay, we will go through some types of research questions for a cross-sectional research. All of us know that cross-sectional research is a type of research in which data is collected only once. Okay, data collection is done only once. Okay, that is why it is known as cross-sectional research. If data collection is done on multiple occasions, then it will be a longitudinal research. So cross-sectional research, data collection will be done only once. And in cross-sectional research, the researcher is studying the prevalence of a condition. Okay, to describe and classify a condition. Okay, so examples of research questions: what is the prevalence of a condition? What is the prevalence of heart disease? What is the prevalence of depression? What is the prevalence of dementia among elderly population? Prevalence, all of us know, it includes both new cases and old cases. Okay, total occurrence of disease, not only new cases but old cases also. What are the various risk factors of a condition? What are the risk factors of depression? What are the risk factors of heart disease? What are the risk factors of dementia? Like that. How to classify the stages of cancer according to size of tumor. Okay, we can classify the disease, classification of dementia, classification of depression, classification of various stages of cancer. To describe and classify a condition, this is one type of writing research question. Okay. Second way to identify the research question is to study the association between two variables. Okay, some examples I will tell you. Is there any association between intelligence quotient and academic performance among medical students? So we have to measure intelligence quotient of a group of students, and we have to link with academic performance. We have to study the association between intelligence quotient's value and academic performance of medical students. Is there any association between computer games and obesity among school children? That is also another type of writing research question. Please keep in mind, a research question means it should be in a question format. What is a question? You are going to find answer. Or what is a question you are going to address during the research? Okay, what type of research design can be used to know the association between two variables? Okay, here in the first question, independent variable is intelligence quotient and a dependent variable is academic performance. To know the association between two variables, you can use cross-sectional design or prospective design. Prospective design, as I already told, it is longitudinal design. Okay, both can be used to study the association between two variables. To compare between different groups. Okay. Are women above 55 years of age more prone to develop cardiovascular disease compared to women between 35 to 55 years of age? So we are comparing between two groups. Occurrence of cardiovascular disease among one age group with occurrence of cardiovascular disease in another age group. Two groups you are comparing. Then, are male workers more stressed than female workers in an IT-based company? Here also we are comparing two groups, males and females. We are checking the stress level of males is higher or different than stress level among female workers. Here also we can use cross-sectional design or prospective design, or both design can be used. Good research questions are those that address the gaps in knowledge. We have to identify the knowledge gap. And a good research question should address that knowledge gap. That is a gap in scientific knowledge. At the same time, it should be feasible for students also, because students are doing a research to learn the methodology, right? So it should be feasible, it should be completable in that frame of time. In terms of cost, sophistication of equipment, analytical and statistical needs, all should be feasible for the students. Okay, we can go through the acronym FINER MAPS. Is an acronym used to describe a good research question. Okay, FINER MAPS. F is for feasibility and fundability. Okay, we have to take into consideration the limitations and problems, okay, that students may face or a researcher may face. There should be adequate number of subjects and affordability in time and money. Affordable, okay. One research need 1 year to collect data. It is not feasible, right? If we can collect data in 1 month, it will be feasible. Money, sometimes so much of traveling required. Students cannot afford. So feasibility and fundability should be taken into consideration. Okay, accessibility of all the materials needed to do this study. The software required, the questionnaire is available and accessible. Software is available and accessible. There should be permission from authority to do the research, permission from ethical clearance committee showing that your research is ethical. All these are important. Adequate number of subjects, adequate technical expertise should be there, affordable in time and money, manageable also in scope. Students should be able to finish it in time. The second second component in finer maps is interesting and impactful. The study should be interesting for the researcher as well as mentors and experts in the field. Okay, study should be interesting. Okay, if it is boring, the researcher will not feel that motivation to do the research. And it should be interesting to the public also. Interesting to the public, useful to the public, impactful to the public. Also, the study should have an impact all over the community. So, finer maps, F is feasibility and fundability, I is interesting and impactful. Third part of finer maps is novel. Novel means the study should bring some new information. You should not reinvent the wheel. What information is not available or which is not studied much should be taken. Okay, a good study should contribute new information and not merely repeat what is already known. Logical reasoning makes research more meaningful. Okay. Newer finding confirms or refutes previous findings. Previous finding, your study should either confirm it or refute it. Refute it means reject it. Extends previous finding. Previous finding, about the disease, but now you are looking for more details, more risk factors of disease or more clinical manifestations of that condition. Okay, extends previous finding and provides new findings about the new disease, COVID, psychological manifestations among people during COVID time. Or some new findings should be provided during your research. Fourth component is in finer maps is ethical. A good research must not pose unacceptable physical risk or invade too much into privacy or confidentiality of study subjects or population. So there are 4 pillars in medical ethics. Okay, beneficence, non-maleficence, autonomy and justice. Beneficence means your research should benefit the community. Non-maleficence means your research should not harm the community or harm the study participants. Autonomy means participants should have autonomy to participate in the research or autonomy to leave from the research. You should not compel the participants. So how we can do? We can get an informed consent. You can tell about the research to the participant. If they agree or if they give consent, they can be included in the research. Then justice. Justice means the social justice should be maintained during the research. Okay. The findings should bring justice to the community. Relevant and replicable. Relevant means what? The topic or research question should be relevant to the community and the population. Okay. Replicability is otherwise known as reliability or repeatability. What is that? If you are doing a research, the finding should be replicable by another researcher. Okay, you are publishing your research in Quest University, Ipoh. Another researcher from some other university should be able to replicate your finding. By doing the same research, they should get similar finding. Okay, replicability or repeatability allows the research to be verified by replicating the study and building basis for decision. So your questionnaire should be made available to others so that others can do the same research. Okay. Manageable. Manageable means what? A research question should be easily researchable and manageable for the researcher with the available resources and expertise. Okay. Feasible, manageable, should be able to finish in the specified time period with the available resources. What are the resources? Manpower, money, material, knowledge, and time. These are the resources. Expertise. The expertise of students, expertise of supervisors should be able to complete the research in time. Appropriate. Appropriate means what? Research question should be appropriate logically and scientifically for the community and institution. Okay. So, finer maps. Manageable and appropriate. Then comes potential value and publishability. When you finish the research should be publishable. The study should be of potential value to a specific group or groups. I will tell you an example. You are doing a study on mental health among academic staff. So, you are finding maybe of interest to all academic staff across the world. So, it should be of potential value to a specific group or groups of people. So, it should have potential value and publishability. It should offer a new idea or concept which can be acceptable for getting published in a scientific journal. So, after you write the research question, you have to ask the question, so what? Is that really important? Okay, is the research question really important and relevant to the community? So, if the answer is yes, it is relevant, it is important to the community, then you go for it. Understood? Then comes last part in finer maps is systematic. The study should be done in a systematic way. Research is structured with a specific steps to be taken in a specified sequence. Okay. In accordance with the well-defined set of rules. Okay. It does not rule out creative thinking. Okay. So, your creative thinking is valued, but you have to arrange the research in a format so that it can be systematic. Okay. It should reject the use of guessing and intuition arriving at conclusion. So, from the finding, you have to apply some statistical analysis to come to a conclusion. If the difference is statistically significant, if the finding is significant, if the finding is important, okay, so you have to follow a systematic way to complete the research. So, hope you understood how to select a research topic and how to formulate a research question. Thank you.